This is Core Conversations with Natalie Baggio.
Welcome to Core Conversations. Today, I'm joined by Dr. John Froggatt. He is here to share the news and new innovations in cardiology services here in Southwest Michigan.
It's my pleasure. Thanks.
If you don't mind, would you just remind the community how many years you've worked here in Southwest Michigan?
Sure. I'm in my 27th year.
Wow, that's really impressive, and busy leading a lot of new services here to grow and bring more access to our community. And I'm really glad that you're able to join today and share more about cardiology. Mm-hmm. So what are some of the exciting things that are happening?
So I think one of the primary things we wanted to touch on is electrophysiology services. And just to jump into that a little bit, electrophysiology is a word that describes a subset of what cardiologists do, which is to intervene when there are rhythm disturbances in a patient's heart. So when that happens, people can experience a sensation of their heart racing or fluttering, some sort of abnormal sensation regarding the heartbeats. And sometimes it can lead into lightness of balance or feeling lightheaded. And so those are all concerns that patients would want to seek help for either through emergency room or primary care physicians or whatever the circumstances dictated. So if that kind of problem is identified by EKG testing, testing the heart's electrical impulses on the recording. The electrophysiologist is a cardiac specialist, that is a cardiologist who has taken additional training beyond standard cardiology training to work on rhythm disturbances in the heart.
Yeah, I remember working as a nurse that patients would actually be able to feel that flutter in their heart.
Right.
And you could actually see it on the monitor, but it's really impactful for people to know that. Now we have like wearable devices to where you can sometimes confirm that you are in a flutter once you've been diagnosed. But yeah, the best course of treatment is for sure to reach out, make sure you go to the emergency room or call your cardiologist if you're experiencing that. But I also have heard people describe like the difference between like an interventional cardiologist and electrophysiologist it's the wiring of a heart, not the plumbing of the heart.
Right.
So electrophysiologists have this skill, ability to be able to perform procedures that you don't always need medication indefinitely to treat AFib. And that's something we're doing here today.
Yes. So atrial fibrillation is the most common rhythm disturbance across the board in the United States and the world, and it's increasing year by year as well. And so that's a disturbance in which there's abnormal electrical activity generated outside the normal electrical pathways that naturally are in the heart. And so as a result of that happening, people can experience a very rapid heart rate and some of these other symptoms. So as you said, sometimes that can be treated with medication, but at times you can go in and target the areas that are abnormally firing electrical impulses and apply a type of energy through a small, thin tube or catheter that essentially destroys the little focus of abnormal tissue and stops the arrhythmia from happening. So if you can accomplish that, then you can potentially come off medications and be free of that rhythm disturbance.
So as we've grown this program, you've been able to recruit new doctors. We've been able to open up more access to services like this. Do you want to talk about and share some of the new physicians that we have? And
Sure.
What is a good way to get a hold of them if the community has AFib or wants to reach out?
Yeah, so we have had electrophysiology services in our community for some time, but up until recently, mostly part-time, so not able to accommodate the full number of patients in the community who would benefit from those services. So recently we did hire a full-time cardiac electrophysiologist. His name is Dr. Levin, and so he's coming to us with experience in the field. He's also brought the sort of latest technology that is being used to accomplish that type of procedure. And so he's really ramping up his practice to see a lot of patients. So if patients in the community are in need of those services, the primary route to access that would be through their primary care providers, who would then refer them to cardiologists, conventional cardiologists, who would then refer them to the electrophysiology specialist.
Well, and you mentioned the latest technology, and that's what's really important as we continue to grow programs. We're just not growing programs, we're growing technology and bringing the highest performing procedures here to Southwest Michigan.
That's right.
So thank you for your leadership in that and recruitment. But you also mentioned like general cardiology. I know you've recruited several new cardiologists here to Southwest Michigan, and there's some evolving technologies that we're adding. Could you share some of those with the community as well?
Yes. So the as you mentioned, there's the electrical system of the heart. There's also the plumbing, which is if you think of the heart as essentially a pump that's made of muscle, there are small blood vessels that provide the oxygen and energy to keep that pump moving. And the small vessels can become blocked. And cardiologists who are the interventional cardiologists are trained to be able to go in and open up those blockages and sometimes put little tubes called stents to keep them open to relieve that problem. So we have a combination of existing cardiologists who have that skill and new cardiologists, as you mentioned, who are coming in to do those procedures. In addition, we have some new procedures that help us to manage different types of patients with different types of cardiac conditions. One is the Impella device. It's a small pump that adds pump function to a heart that's struggling. So to support certain types of procedures, that pump can be put directly into the heart, again, through one of those long, thin tubes to keep the heart going while other things are accomplished. So that's something we've just started recently and have done several patients with that. We also have new testing modalities. So there's a cardiac CT imaging, which is an advanced form of CT scanning that allows us to look for both structural abnormalities and functional abnormalities of the heart in a new way. And that's something that the cardiologists can sort of apply in the span of all the tools that they have available to figure out what's wrong with someone's heart. That's a new thing that's now available in our community.
And that's just amazing with the new evolution of technology, how before those were invasive procedures, and now having something like this allows non-invasive diagnosis.
Right. So that's available for the patients with whom that their condition matches that need. And then we're heading towards cardiac MRI imaging as well, which is another form of advanced imaging to help us diagnose heart conditions. So lots of things going on, and really happy to be able to offer the full span of services for cardiology in our community.
Well, thank you to your leadership and recruiting new doctors, new cardiologists specifically, and now being able to see cardiologists in 3 sites.
Right.
Waterville, St. Joe, and Niles.
Yes, we're excited to be able to broaden out in that fashion.
Yeah. Is there anything else that is new or on the horizon that you'd like to share today?
I think that's most of it. We are partnering with, in our larger system, with physicians at Corewell Health West for tertiary care types of interventions that would be beyond the scope of our community hospital. And so we've developed new ways to get patients engaged in that care. We also have an advanced heart failure clinic here in our community, staffed by an expert from Corewell Health West, coming down a couple of days a week, with another big addition to what we can provide locally instead of having patients travel outside of the community to get those services.
Yeah, and historically, before being part of a larger system like Corewell, we would have to send patients to Ann Arbor or Chicago, and now we're able to bring those services here to Southwest Michigan.
That's right.
That's wonderful, and leveraging the larger system as we continue to grow to keep care local.
Indeed.
Thank you for watching this episode of Core Conversations. We'll see you next week.